Greetings, everyone. I'm Anupama Jha, currently associated with Pirumal Foundations. I work for the leadership and development of healthcare providers in Bihar. My project with WomenLift Health is compassionate leadership in healthcare, its impact on service delivery, and female healthcare providers. During my journey as a public health professional, I often ask this question to myself. Can compassionate leadership foster the agency to serve in healthcare providers? Don Berwick has rightly said, fear is toxic to both safety and improvement. Abandon blame as a tool and trust the goodwill and intentions of the staff. I believe that every healthcare personnel has an underlying desire to serve the community. My theory of change is sustainable public health institutions can only be created through purpose driven and compassionate leaders who are committed to changing self as a pathway to changing the system. I chose to work with District Hospital Sitamarhi as it was one of the poorest performing districts in Bihar in terms of footfall in OPD, perceived lack of care in patient, poor interpersonal relationships between the staffs. I engaged with 50 healthcare providers across all the 19 departments in the district hospital that also included ancillary and support services staff. Purpose was to build a culture within the facility for improving patient and staff experience and to understand the impact of compassionate leadership in female healthcare providers. A multi-pronged strategy was developed for the same in terms of focused group discussions in clusters of 20 to get a diverse perspective. Questionnaire was run with 100 different healthcare providers. An observation of 40 instances of service delivery was done to understand the workflow and potential bottlenecks, and one-on-one discussion was done to gain trust and rapport with individual staffs. Interestingly, the baseline highlighted the importance of leadership and culture, managing agitation and aggression, compassionate care, and physical health and mental well-being. Different interventions conducted during the past 1 year included compassionate leadership workshops, team building exercises, grounding exercises, learning by engaging in reflective processes with peers, taking up of live action projects by the staffs, conducting morning assemblies to cultivate a sense of gratitude and feeling of oneness, and collaborating beyond hierarchies and forging mental steel through sports activities. A shift of culture was clearly observed in the hospital through activities like yoga sessions, ice-breaking activities, putting up hoardings at public places showing team spirit, and a unique way of celebrating Nurses' Day and International Women's Day, organizing daily debriefs. Interestingly, while only 6% of females are there in the leadership positions across the state, Sitamarhi District Hospital has 37% of females who have been engaged in key decision-making processes and leadership positions who are driving the quality care initiatives. My key learnings during my project were that addressing wicked problems often requires innovative and multifaceted approach that go beyond traditional interventions. Behavior change is difficult to observe and quantify. Spirit of agency is difficult to sustain, and creating a safe space for stakeholders to express their vulnerabilities is indeed challenging. WomenLift Health will always remain close to my heart. I express my gratitude to the entire WomenLift team, my coaches, mentors, 2023 cohort. This has been an incredibly empowering and transformative journey for me. I have evolved as a self-aware individual who believes in herself, and I have been able to amplify my impact on ground in a huge way by leveraging the strength of my team and support of my peers and network. I thank Karthik Verma, my supervisor and mentor, for trusting my passion and recommending me for this program, my group of peers for support, and my team that truly inspires me to do some real work and bring some impact on the ground, my family for giving me unconditional support always. Thank you.